Down syndrome is a genetic condition in which the person has 47 chromosomes rather than the normal 46. In most cases, Down syndrome occurs when there is a copy of chromosome 21. The extra chromosome causes problems in the way the body and brain develop. Down syndrome symptoms vary from person to person and can range from mild to severe. Children with this condition have a widely recognized appearance. Their physical development is slower than normal, and most children never reach the average adult height of their peers. Children with Down syndrome may also have delayed mental and social development. Common problems may include impulsive behavior, poor judgment, short attention span, or slow learning. As children with Down syndrome mature, they may become aware of their limitations and feel frustrated and angry. It is in this area that we as teachers need to step in and help these students feel successful and confident. One issue that teachers need to be aware of, but is probably not something we would think of first, are the chronic health conditions that students with Down syndrome often suffer from. The student's health might be poor. These students may have trouble eating or sleeping, and they may suffer from chronic ear or sinus infections. These health issues may affect the student's performance in class and ability to concentrate, and it is our job as educators to watch for a sudden change in the child's personality, as this may indicate a health complication. There are also physical limitations that students with Down syndrome experience. They often have decreased muscle tone, which affects their mobility, posture, breathing, lethargy, and poor reflexes. Teachers must take some changes in their classroom to accommodate these limitations. Giving students extra time to complete tasks, provide increased opportunities for them to practice skills, and working with physical therapists are a few ways to support these limitations. Students with Down syndrome also have difficulty with speech. Think about how it would feel to always be talking with your mouth full. These students may feel embarrassed trying to give a lengthy answer to a question. As teachers, we need to be mindful that periods of questions and answers might create some anxiety for these students. Sign language is often helpful, but we also must ensure that these students are also supported by their classmates during these difficult tasks. Down syndrome students will also have some difficulty with their short-term or working memory. They are not always able to process the information that we are presenting at the same pace as the other students. We must allow more time for the students to learn and apply their knowledge. These students do best in small group instruction. Computer-based curriculum is also very helpful because language supported by visuals or movements help these students maintain and retain the information. Computer-based curriculum is also interactive, self-paced, and not threatening. Finally, hands-on activities are very effective with these students. Presenting information in small increments is also helpful. Because each student with Down syndrome is different, it is best to assess their mental age in comparison to their chronological age and modify your lessons accordingly. These students want to feel that they are part of the class, and it is our job to ensure that the classroom is a safe and secure place for them.